Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Taking your calls right here, right now, 866-870-5752, and we have Basil on hold.
Hey, Basil, Dr. Marc Darrow, how are you today?
I want to say God bless you guys for
thanks.
Having this program. I've listened to you for a while, and you give people hope without surgery, and that's the best thing. I myself have a little bit of a shoulder problem. I've been a weightlifter all my life. I'm a tennis coach, teach tennis. There's some things I don't do anymore. I don't do shoulder press. I do a little bit of upright rows. I'm working around it. All the stem cell guys say that you got to fly to Panama and get somebody else's blood in there. I'm not into that. And I had an MRI a while ago, a couple of years ago, and they said, there's whatever, I don't know what. It looks like on my left shoulder, one of the shoulder muscles looks like it kind of collapsed a little bit. But, of course, I didn't go to anybody, and I don't know anything about it. But I love listening to your program, and you kind of make me want to check it out,
Well, that's good. Dr. Grove, why don't you pipe in here?
Yeah, Basil, great to hear from you. Thank you for the support. So for the shoulder, what we can really do is get a good, proper diagnostic scan with ultrasound. It's dynamic, meaning I'm going to move that tissue around, and we can actually see what that tissue looks like in real time. We combine that with a good, proper physical exam to see, where your pain is potentially coming from in order to put the best plan together for you. Again, we talk about it every week, but when you have a static image, meaning, you're laying down flat and you're not moving the tissue around, with things like x-rays or with MRIs, it doesn't always give you the best full picture of what's going on with your anatomy. So you'll get a kick out of coming in, and we'll give you out with. Based on what you're saying, you might have like a rotator cuff issue. Very, very common problem that we see in the clinic. The rotator cuff is a set of 4 muscles that allows you to maneuver that shoulder up and down and rotate it in and out like you're putting your hand in your back pocket or touching your opposite shoulder. So very commonly area to be injured, and we'll get a good sense with the ultrasound in the clinic.
By the way, Basil, you'll be sitting there watching the screen on the ultrasound as Dr. Grove actually shows you the tissue. And he can see, would you say, up to a millimeter? Is that the smallest?
So even then, we can actually change the orientation of the probe. So I'm taking multiple slices or different angles of that picture throughout that tissue. So that's another thing too, is when you're getting some of these images, it looks like there might be something really bad, a big tear, but it could just be a little bit of what we call artifact, meaning a little bit of image. But with ultrasound, I can really eliminate that issue by changing the orientation of that probe, which is the device I hold in my hand, which actually puts out the ultrasound waves and receives those waves and then displays a picture on the screen. So it's pretty neat that you can actually watch in real time. If you ever have a question about, what is the tissue supposed to look like, or, what does the tear look like, I point it out right on the screen for you. And even better, when we're doing a possible treatment with you, I encourage all patients that you can look at the screen in real time too. You can see the needle going directly into these little tears, which is pretty neat for the patient to see.
So, Dr.
Right.
Grove,
I mean, that sounds great. I might not want to see that, but
no, you'll want to see it. You'll want to see it. It's something that is so beautiful to watch, and I always like people to watch whatever they're doing. If they're getting a blood draw, sometimes people will look away. I go, please look, because you need to desensitize yourself to these things that you're going to be living with the rest of your life. So why not get over it now? And the first time it might be kind of odd, but after a while you'll really get into it. It's like a space-age technology. And Dr. Grove, what do you think the biggest difference between an ultrasound and MRI, other than it being the MRI is static, nothing is moving, and the ultrasound is dynamic? What about the actual images? Do MRIs pick up things that aren't there?
All the time. So again, it gets to the point where I can move that probe around, where I can actually see a defect or something wrong with that tissue from multiple angles. With MRI, it's not so much, right? And again, when you're getting a read from an MRI radiologist, anything that does not look perfectly normal, they're going to call out saying, this could be suspicious for something that sounds really scary. You want to correlate that clinically with the picture. So we get a lot of MRI reads. That's, majority of our first visits is just talking people off the ledge with their MRI results, because we can show them on the ultrasound in real time what they thought that they saw, but really in real time looks very different.
Yeah, and then this leads to another thing. Basil, you hang on with us because we're going to talk to you some more, but we're going to throw some, information.
I got to come see you guys, so I got to fix that out. So I hate I have to run myself.
Oh, okay.
Because you guys are fantastic.
Okay. Well, let me just say this. I was an extremely avid tennis player, and I ripped up my rotator cuff. I've got 3 tears in my right shoulder. I have a subscapularis tear. That's one of the rotator cuffs. I have a supraspinatus tear, another rotator cuff tendon. And then I have a labral tear, which is the lip fibrocartilage around the actual humerus bone. I have 0 pain. And I've self-injected my shoulder when it was painful and healed it up. And I've done both my knees, both my elbows, my right wrist, and both shoulders. I've had other people do my neck and back. And every place that I've injected or had other people inject have healed. I've been very, very fortunate. So I'm just putting that out as the hope for you getting your shoulder better so you can do overhead presses, have a smash, what's the hardest serve there is in tennis? The reverse twist thing?
You have the serve, and the guys are serving 150. I'm a small guy. I'm not going to do that. But listen, you're the best. You are a very gifted doctor, and I got to come see you guys because the message that you put out is fantastic.
Well, God bless you, Basil. And the phone number to the studio, again, the phone number to the office, so you can get an appointment if you want to just talk to some other specialist there of our staff. The number to the office is 800-300-9300. And there's people there by the phones working today, usually most of the time. So again, that's 800-300-9300 at the office. So Basil, be on your way. It sounds like you're in a rush. God bless you. We appreciate your call.
Thank you.
And we're going to mail you out a free copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with a foreword by
you so much.
Suzanne Summers, the very famous actress who we have worked on her family. And she's written chapters in a few of her books about us and the work we do. So God bless you and have a wonderful day. And I hope you're back to pumping iron the way you want and playing tennis as hard as you ever have.
Thank you.
So Dr. Grove, that was a good case there.
That was good, yeah.
Yeah, and someone that I think we could help just, without even looking or touching, just from what he told us. Those are typically cases that we work on. So Dr. Grove, I'm going to hit you up and give you, they call it, you ever hear the word pimping when you're in med school?
Oh, yeah.
Yeah, where we ask the students, because I'm the old man and you're the young guy, we ask them questions and put them on the spot. So do you know any science about regenerative medicine?
So this week we looked at some hormone studies, which are pretty interesting. So sometimes people forget about the hormone aspect of pain. It's a really great study. This is back from 2008 in a journal called the Reviews in Pain. Title of this study, if you guys want to look it up alongside with me or watch the recording, you can look this up. It's called Hormones and Their Interaction with the Pain Experience. So it's a good overview on the front end of this article looking at, what is pain, what are the different sources of pain, which is a complex issue, and they focus more on the hormone aspect of things, specifically what we call sex hormones. Those are going to be things like estrogen, progesterone, and testosterone. So we get really put into a corner with these hormones thinking they only do one thing or they only do 2 things. This article really points out the relationship with pain. So these hormones act through receptors, right? If the hormone's not going to act unless it's got a receptor to bind to. And what the study looks at is the location of these receptors. So they're all over the nervous system. They're all over the immune system. They're on bone. They're on the surfaces of joints, in addition to ligaments and even blood vessels. So they look at different...
What is the take-home point about this?
Yep, take-home point is hormones, when they're optimized, can lead to decreases in someone's subjective pain, right?
Okay, good.
Just like anything else in medicine, you can overdo it, you can underdo it. That's why it's really important to have your hormones monitored by a physician. But the point is that you've got all these other areas that could potentially be benefiting from hormone optimization.
So you're saying that balancing the estrogen, testosterone, and other hormones can actually help get rid of pain?
Absolutely.
Yep, and I've seen it many times. I do quite a bit of hormone balancing and supplementation, you might call it. As we age from our 20s on up, men are losing their testosterone, and they know it very well by having erectile dysfunction in their 40s, 50s, 60s, 70s, and on up. And their doctors will say, well, I checked your testosterone, it's in the normal range. Yeah, when you look at it on the bell curve, statistical analysis, it's in the normal range for someone who's 100 years old. It's at the bottom of the barrel. And so to me, that's not normal. You've got to be up in the top level to be functioning properly and to help get rid of pain. Same thing with women. And women need testosterone too. Men and women have the same hormones, just in different balances. So women typically will lose their testosterone after having a baby. That natural instinct to procreate is put down with a lower testosterone so the mom can take care of the baby. And that fluctuates with women at different times of their life. So very few women that come in to see me have much testosterone, if any. And their estrogen is low, their progesterone is low, and they're not in a happy state. They're not sleeping well. Their memory is poor. They have no sex drive at all, and the relationship with their husband is down the tubes often because of that. So it's very easy to get labs to find out where someone's hormones are, men or women, it doesn't matter, and then we can tune them up based on their labs. We don't just give hormones without doing it scientifically. I actually did a 2-year course in hormones, a fellowship after my residency at UCLA in physical medicine rehabilitation. And I'm a lifelong learner, just like Dr. Grove is. I know he stays up late every night reading studies and learning more and more. And I think one of the biggest problems that we have in what we'll call modern medicine is a doctor goes to medical school, he learns what he's going to learn, and that's it. He will not budge off of what he learned. And it doesn't take into account, that type of medicine does not take into account things that can heal you naturally, easily. And we like people not to be on medication unless it's absolutely necessary. If you've got a high dose of hypertension in your system and you can stroke, we like when you're on an antihypertensive medicine. But if you're on anti-inflammatory medicines for pain, that's no good. That's not good for your kidneys and your liver. And the studies actually show that if you take anti-inflammatory medications like ibuprofen, that the joint degenerates faster than if you take no medicine. Okay, there's a lot of reasons for that. One is you feel better. Yes, you do. So you're too active for what your body is there to tell you. Pain is a good thing. It's letting you know there's an issue. The other thing is, in order to heal the body with regenerative medicine, part of that process is to inflame the body. When we inject you, we're actually creating a short spike of inflammation. That's good for you. It brings in fibroblasts. It sequesters or draws fibroblasts to the area of the injury where the solution is placed, and it spikes the inflammation. The fibroblasts come to that area, and fibroblasts are cells that actually grow the tissue. They put out collagen. We are made out of collagen. It's in our muscle, bones, it's in our eyes, it's in our hair, it's in our blood. It's the structural protein of the body. So if you want to think about it scientifically, Dr. Grove's job and my job is to stimulate collagen growth in the body. That's our job in a very simplistic manner. And collagen is the major constituent of cartilage in the joints. So we have the collagen in the tendons and ligaments, and we have in the muscles. We do a lot of muscle tears too, and it's just regrowing that collagen. And then when we get into the joints, the covering on the joints, what's called the articular cartilage, we can actually regrow some of that. So if you have a meniscal tear in your knee, which is fibrocartilage, in my particular knees, both my medial menisci were torn. I injected both of those, and there was a time period a few years ago where I was in such bad knee pain that I was on crutches, hobbling around the office, embarrassed taking care of my patients. And I came in after an injury on the golf course, and it was a Sunday afternoon. I drove down to my office from Mountain Gate Country Club, and I put an ultrasound on my knee, my right knee, and there was 45 cc's of fluid. I called up Jeff, who's one of our nurse medical assistants. He drove over to help me, and we put stem cells right in that day and then 3 more days in a row. So that's a question on timing. Dr. Grove, how do you feel about the timing of what other people do with these injections, with this treatment, and what other doctors do?
The timing of regenerative medicine injections really is an art. I've trained all over the world, all over the country, and everyone's going to have their own protocols. Like you mentioned earlier in the broadcast, it's really important to go to providers who do this at a very high level and they've seen a lot of patients, right? So when we have a treatment and let's say we treat them again in 3 months or 6 months, we find that we can heal them much, much faster than that. And the downside of waiting so long between injections is we want you to not work out that area, right? If we inject the knee, I don't want you, going on a long hike until you're healed up. Now, if you needed a couple of treatments, now you're 6 months, maybe a year into it, we could have healed you up potentially in a couple of weeks, maybe a month or two. Meanwhile, you're losing a lot of muscle mass if you're not active, right? So it's a balance between injecting frequently versus spacing it out. Potential downside if you inject too frequently is that you get a really robust inflammation response, which some patients won't like. We really find the optimal time frame is about every 2 weeks. So if you come in for a treatment, we get you treated up. We have you follow up in 2 weeks and see how you responded to treatment. And if you're 100%, you're 100%. If you still have a little ways to go with your pain, you can consider doing another treatment at that time. So we find that's an optimal time frame for you.
What we like to do is do our treatment and then have you come back in 2 weeks to assess and see where you're at. It's up to you if you want to treat or not. It's always up to the patient. It's not up to the doctor. And I'm going to give out the phone number because we have a few more minutes left. If you want to talk to us live right now, Dr. Grove and I are waiting for you. And the phone number for you to call, write it down, 866-870-5752 at the studio. That's 866-870-5752. And if you want to get a consult over the phone by our specialist in this, our staff, you can call them right now at 800-300-9300. They field all those calls for Dr. Grove and I and answer your questions. That's 800-300-9300. And if you want to watch videos of these procedures, go to the website, which has tons and tons of scientific studies in it, endless pages that you can learn about regenerative medicine of stem cells and platelets. And the browser for that is www.jointrehab.com. That's the domain name, www.jointrehab.com. You'll see tons of videos of the procedures being done, the injections. You will read tons of information. And as a bonus, every single page has a spot to email us. And we answer our emails every single day. So if you email me today, you're going to get an answer back today or tomorrow. I don't care if it's a weekend or whatever it is. And we love educating people. I think Dr. Grove and I, more than anything else, love educating people about this. I want to call it a new form of medicine. It really isn't. It's been around since the late 1800s in injection form. And back in China. There's reports of it 5,000 years ago.
Excuse me, Dr. Darrow. We have Patty in Whittier. Would you like to speak to her about her right shoulder?
Patty, Dr. Marc Darrow and Dr. Thomas Grove, your shoulder's bothering you. I just want to mention before we take your call that we inject everywhere on the body. We had another call about shoulders. We typically, on different days, end up with people calling about one body part. But we inject from the head all the way down the neck, shoulders, arms, the bicep tendons, the elbows, the rotator cuff tears in the shoulders, the labral tears in the hips, the meniscal tears in the knees, the arthritis in the toes and hands, things like plantar fasciitis in the foot, Morton's neuroma, gamekeepers in the thumb. There's just all of these different syndromes that a lot of you folks have. We treat all of them. There's nothing on the body we don't treat. And with Dr. Grove running the ultrasound, it's a very, very safe kind of procedure because he can watch where those needles are going. So, Patty, how long has your right shoulder bothered you for?
Well, it's been quite a while. I would say about a year and a half.
Okay. And was there something you did? Did you fall on it or overuse it?
Not that I remember.
Okay.
I went to see a doctor, and he said that it was the rotator cuff.
Okay. Did he do an MRI to tell him that, or he just assumed that?
No, he just assumed that. He had me move my arm and turn it, twist it, and he said it was the rotator cuff. He said he wanted to inject steroids. Yeah. And I said, no, I don't want to do that.
Boy, you just pressed one of my buttons when you said that word steroid. Typically the type of steroid that's used is cortisone. There's a lot of different names for it. But Dr. Grove, do you want to address that issue and your feelings about it?
Yeah, anytime I hear people going for steroids, unless you're a professional athlete and you need to play tomorrow, it's really a bad idea. So lots of studies have come out looking at the effectiveness of these medications when you inject it. Cut to the chase, it actually worsens your pain, down the line, and it can lead to an increased rate of actually having a ligament or a tendon tear. And actually advances your arthritis. So if you put it into a tendon, it's more likely to tear. You put it into the joint space, it's actually going to wear out that cartilage faster and fast track you to having worse arthritis. And the reason that it's still used today is because it can be effective for pain, but it's in the short term, right? So we'd rather heal that tissue up and give you long-term relief rather than just putting a Band-Aid on the issue with steroids.
So I want to tell a quick story, Patty, to give you more of a flavor what this is like. Now, Dr. Grove mentioned that if you're an elite athlete and you're getting paid, $50 million on a contract, you might get a steroid shot to play tomorrow. But what he didn't say about that directly was that's the worst thing in the world you can do for that athlete because it's going to lead to a long-standing injury. And I'm going to give you a story that is kind of a chuckle. There was a doctor who was, I think, Dr. Grove, you may know the answer to this. He was the doctor for the NFL. His name was Rob Gazinga. Oh, it's over. Anyway, he got kicked out. He lost his job because he refused to do steroid shots on his athletes during the game. So I'm going to give out the phone number to the office. Give us a call, 800-300-9300. Go to the website, www.jointrehab.com. Patty, we love you. God bless you, Anita Valens, Suzette, Alex, and Dr. Grove. We love you all.
And we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff for free. And ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.